Ginger, long regarded as a humble kitchen spice, is far more potent than its everyday use suggests. This ancient root harbors a wide array of bioactive compounds, most notably gingerol, a strong anti-inflammatory and antioxidant agent that contributes to many of its health-promoting effects. Far beyond flavoring soups and teas, ginger has proven itself as a supportive natural tool for several chronic health issues. But despite its benefits, it must be used with awareness and care. One of the most widely accepted benefits of ginger lies in its ability to soothe digestive discomfort. It stimulates saliva and bowel production, aiding in the breakdown of food and preventing bloating or indigestion. Its effectiveness in relieving nausea, especially motion sickness, morning sickness during pregnancy, and even nausea induced by chemotherapy, has been supported by multiple clinical trials. For many people, a small dose of ginger may work better than synthetic medications in easing these symptoms, without some of the side effects. However, excessive use can irritate the digestive tract, especially in those with ulcers or acid reflux. Emerging evidence also suggests that ginger may help modulate blood sugar levels, offering potential value in preventing or managing type 2 diabetes. Gingerol may enhance insulin sensitivity and improve glucose uptake by cells. While this is promising for those dealing with metabolic syndrome or insulin resistance, it comes with a clear caveat. Ginger should not be treated as a substitute for medical care or used alongside diabetes medications without supervision, as it could unpredictably amplify their effects and lead to hypoglycemia. The anti-inflammatory properties of ginger also extend to joint health. In individuals with osteoarthritis or rheumatoid arthritis, regular consumption has been associated with reduced pain and improved mobility. This is particularly appealing as an alternative to non-steroidal anti-inflammatory drugs, NSAIDs, which, though effective, can damage the stomach lining and raise cardiovascular risk over time. Ginger presents a gentler option for chronic inflammation, but it is not side effect-free. In high doses, it may increase bleeding risk, especially for those on blood thinners, and should be approached cautiously. Ginger's cardiovascular potential is another reason for its growing reputation. Some studies suggest it may lower LDL cholesterol and reduce oxidative stress in arteries, theoretically protecting against plaque buildup and hypertension. While these findings offer hope, they are not universally consistent across populations or doses. Over-relying on ginger while neglecting lifestyle and medication can be dangerous. Its effects are likely modest when isolated and should be seen as part of a broader, integrative approach to cardiovascular health. Ginger even shows promise in modulating immune response and possibly offering some anti-cancer benefits, particularly due to its ability to inhibit the growth of certain cancer cells in lab settings. However, these findings remain largely preclinical. It would be irresponsible to promote ginger as a cure or preventive agent for cancer without more rigorous human trials. Still, its low toxicity and wide availability make it a candidate for further study and cautious inclusion in wellness protocols. Used wisely, ginger is an impressive plant with far-reaching physiological effects. It offers real support to people battling nausea, metabolic dysfunction, chronic inflammation, and even early signs of cardiovascular or immune imbalance. But it is not harmless. Like all powerful botanicals, its bioactivity can interact with medications, intensify underlying conditions, and cause harm if misused. Respecting its potency means not falling for exaggerated claims or using it as a magic fix. Ginger deserves its place in both culinary and medicinal traditions, not because it's miraculous, but because it's modestly effective, safe in moderate amounts, and supported by a growing base of science. Its potential will continue to expand, but only for those who use it mindfully, as part of a balanced and medically informed lifestyle.